We need a big part of the problems in Burlington and Vermont is healthcare. We have public safety and healthcare. I think are the two main issues. And if you're a candidate right now and you're not focusing on those issues, I don't know what if you're focusing on ICE, federal government, look in Vermont. We have this system called the Green Mountain Care Board, which regulates how much UVM can charge, how much revenue they can bring in. And whoever came up with the idea that UVM should buy all the practices, independent practices, while being under the guise of an institution that regulates how much money you can bring in, I have no words. And
yeah, me either.
my wife's a dermatologist here in Vermont, and it's almost impossible to get in, to go see her or any specialist of that matter. And we have an aging population here. And as the mayor, I don't see her, maybe I don't know, but I don't know if she has any plans to how to help the hospital system, which is in her city. And I have plans to help the hospital system. I have a plan to create the biggest HR campaign to encourage physicians to move to the most beautiful place in the country, where you can ski every weekend with your kids, you can go on your lake. We need a plan to bring doctors back in Vermont.
Doctors, dentists, nurses, like all of it takes months, as you said, months to get in with a specialist. 13 and a half months before I had my first appointment.
People are, I'm gonna say this openly, people are certainly losing their lives prematurely as a result of not being able to access healthcare here. But, you know, I'm trying to get an MRI right now. It's a 4-month wait for an MRI. The average wait, I think in the United States, is about 3 weeks. So we're much closer to a Canadian healthcare system here, which is already a socialized single-payer system, which is, in my opinion, is not adequate to address what the healthcare that people really need. So yeah, we really need to figure out the healthcare solution here in Vermont.